Beta blockers are a cornerstone of cardiovascular therapy that has revolutionized the management of conditions like hypertension, heart attacks, and even certain anxiety symptoms. These drugs act as guardians for our heart and blood vessels, ensuring that they function without undue stress. We'll explore how these drugs interact at the microscopic level, shielding beta receptors from the surges of adrenaline. Yet, like all medications, there are interactions and potential side effects. When we're done, you'll appreciate the balance between their therapeutic uses and the caution needed when combining them with other medications. Let's begin with the mechanism of action of beta blocker drugs. At the foundation of their action lie the beta receptors. Beta receptors are a kind of protein found on the surface of cells, acting as a kind of lock awaiting its key. These receptors are further classified into beta 1, primarily located on the heart, and beta 2, largely found in the lungs, arteries, uterus, and several other organs. If you can remember a time when you were startled or anxious, and you felt your heart racing, this palpable acceleration of your heart rate is courtesy of chemicals called norepinephrine and epinephrine, which naturally occur in our bodies. They attach to these beta receptors, specifically beta 1, urging the heart to beat faster and pump harder. Beta blockers, as their name suggests, block these chemicals from binding to the receptors. By doing so, they cause a decrease in your heart rate and blood pressure, ensuring the heart doesn't overexert itself. But remember, in medicine, nothing is ever that simple. Not all beta-blocking drugs are created equal. Some are selective, targeting mainly the beta-1 receptors in the heart, ensuring that the heart remains calm and composed. These are aptly termed selective beta blockers. Others, the non-selective ones, have a broader reach, affecting both the heart and lungs. This distinction is crucial in clinical practice, as it determines the drug's effect on a patient and potential side effects, especially in those with respiratory conditions. Beta blockers, while tremendously beneficial, do not operate in isolation in our body. They interact with a number of medicines which can modify their therapeutic effects or give rise to unintended consequences. A common interaction to be aware of is their interplay with antihypertensive agents. When combined, there is a magnified effect in reducing blood pressure. While this might sound advantageous, it can lead to a rapid drop in blood pressure, rendering symptoms like dizziness or even fainting, especially upon standing. Next, consider the anti-arrhythmic drugs, which are deployed to regulate heart rhythms. When these are co-administered with beta blockers, they can intensify the cardiac effects, potentially leading to an excessively slow heart rate or other rhythm abnormalities. This necessitates a careful titration of doses and frequent cardiac monitoring. For those managing diabetes, a vital point of caution is the beta blocker interaction with diabetic medications. One of the lookout signs of hypoglycemia or low blood sugar is a racing heart. Beta blockers, by virtue of their action, can mask this warning sign, potentially leading diabetics to overlook a hypoglycemic episode, which can have severe consequences. Lastly, a crucial interaction to be aware of, especially in patients with respiratory ailments, is with asthma medications such as albuterol. Beta blockers, especially the non-selective ones, can counteract the bronchodilation or airway opening effects of these medicines. This means that a patient's rescue inhaler might not be as effective as it should be when it's needed most. In clinical practice, understanding these interactions isn't just about memorization, but about crafting a holistic treatment strategy. Given that beta blockers primarily target the heart, it's no surprise that some of their most pronounced side effects are seen here. One such effect is bradycardia. a condition where the heart rate becomes slower than usual. While a calm heartbeat can be therapeutic for some, an excessively slowed heart rate can lead to symptoms like fatigue, dizziness, or even fainting. Additionally, beta blockers can cause hypotension or low blood pressure. While reducing high blood pressure is a sought-after effect, an excessive drop can result in dizziness, especially upon standing. Patients, especially those with asthma or chronic obstructive pulmonary disease, may experience bronchoconstriction, a narrowing of the airways, leading to shortness of breath or worsening of their underlying respiratory conditions. This is particularly evident with non-selective beta blockers that also target beta-2 receptors in the lungs. Beta blockers can, in some individuals, lead to symptoms like fatigue, dizziness, or even depression. It's essential to note these especially in patients who are predisposed to mood disorders or in those who report a sudden onset of such symptoms. Lastly, the metabolic effects of beta blockers cannot be overlooked. While they play a pivotal role in cardiovascular regulation, they also alter lipid profiles, potentially elevating triglyceride levels and lowering beneficial HDL cholesterol. One of the most common indications for beta blockers is hypertension or high blood pressure. Chronic elevation of blood pressure can lead to significant strain on the heart, blood vessels, kidneys, and other vital organs. By reducing the heart's workload and dilating blood vessels, beta blockers can effectively bring down blood pressure to safer levels, thus playing an important role in the prevention of long-term complications such as strokes, heart attacks, and kidney disease. Another common indication is angina pectoris, a type of chest pain that occurs when the heart muscle doesn't receive enough oxygen-rich blood. By slowing the heart rate and reducing the heart's oxygen demand, beta blockers can alleviate anginal symptoms and improve exercise tolerance in these patients. In the aftermath of a myocardial infarction, commonly known as a heart attack, beta blockers are invaluable. They've been shown to reduce the risk of subsequent heart attacks and improve overall survival. By decreasing the heart's oxygen demands and preventing harmful arrhythmias, they play a protective role in the heart's recovery process. And speaking of rhythm, beta blockers also have a role in managing certain arrhythmias or irregular heart rhythms, particularly in conditions where the heart beats excessively fast. These drugs can stabilize the heart rhythm and prevent potential complications arising from these arrhythmias. For patients with heart failure, a condition where the heart is unable to pump effectively, specific types of beta blockers have emerged as frontline therapy. In heart failure, they help slow disease progression, reducing hospitalization and enhancing longevity. Lastly, though not a primary cardiac indication, beta blockers have found utility in managing certain symptoms of anxiety. For instance, for those who experience palpitations or tremors associated with anxiety, these drugs can offer symptom relief. With that said, thanks for watching.